Hello friends, thanks for checking out the video. Be sure to like and subscribe as it greatly helps out the channel and I'd really appreciate it. Enjoy! It looks at mobility, right?
Yeah.
Y'all mentioned, at least at the time, right,
Yeah.
from, I have it up here, the Coronavirus Resource Center,
Yeah.
dated 2020 at Johns Hopkins, that over 250,000 Americans had died, which contributes to 20% of all verified COVID deaths when the U.S. only accounts for 4%
Yeah.
of the population. So
That's
just
over a
thought that-
million now, by the way.
It's over a million.
Over a
now.
million U.S. deaths
Wow.
due to coronavirus, and it's still a similar percentage. It's still a disproportionate share of deaths. We should have closer to 4% of the deaths. We have a much higher percentage of that. That reflects the failures of our public health institutions, our medical institutions, our poor healthcare system that leaves so many uncovered, and the politicization of it. It really does. The unique social and structural context and resource environments of our country really put us at a unique disadvantage relative to even poor countries.
Wow. And so I'm curious, do you know, at least even now, like what's the kind of rate or percentages for like the country like right under
I don't
Okay.
remember that I just because I was focusing on the US, but I just remember that's still consistent today, that we have a disproportionate. Yes, but that's very much consistent with the public health embarrassment that this country has. When you think of health,
Yes.
black white mortality gap, so forth. There's so or over
the prison.
Over the prison. Like we take more medicines than other countries do, more antidepressants than other countries do, so forth. We have a population environment. For as much as we spend on healthcare, health outcomes are not, and pandemic is just this manifestation of that. You have a healthcare system that is on the edge. It's always on the edge. There's just enough beds, just enough masks, there's just enough medicine, and but if we have any, because that's the most efficient economic strategy.
Oh yeah.
In terms of streamlining profits. But if you have any public health crisis, all of a sudden, we have to erect hospitals and parking garages, and there's not enough masks for our frontline healthcare providers. There's not enough medicine or ventilators and things like that for healthcare, and they really let us down. They really let us down, and this goes back, president, to. Obama had an opportunity to restore a lot of the public health stores of masks and things like that, and ventilators and things like that. He chose not to do that, and then of course Trump didn't do it. So this spans political presidencies.
And you bring up a good point, and even in chat, they're kind of asking like, so even with all these factors, like always being on the edge and sometimes frankly just not being able to truly help, why is healthcare still so expensive? And of course I think just my knowledge is a lot of it goes back to insurance companies. Right. You also have big pharma. It's hiking up the price. Who is it? They called him the pharma bro, but it was this like Skrelly. Yes. This guy
went to jail.
He is in jail, but he's getting out relatively soon. But he can't work on the stock market for like 10 years, something like he kind of got banned, which is still ridiculous. That's only 10 years, right? It should be, you'd think they'd make it a lifetime. So for those that don't know, individuals like this, who he got it as a life-saving medicine for those with, was it diabetes?
I think it was something like that, or epi or something, pen or something.
I think I don't know what it was. So something, a pretty common medication
that there was no alternative for.
And that's the big thing. No alternative for, and it was like $17 for dose or something like that. And he hiked it up. I forgot how many, like thousands of percents, to like over $700. And of course you're like, well, the insurance will cover it, right? But this comes out to the problem is like, well, what if you don't have insurance? You're still expensive, but very affordable medication that you need. There's no alternative. Is now almost $1,000.
Yeah, that's a new pharma model. He's not the only one to do this. You can find tons of examples where rich people come in, they buy a company, they find out that medication that there is no generic for, no alternative for, and they buy it and then increase the price 5,000% or something like that. Get a quick windfall, and when they start getting when the media gets wind of what's going on, that people can no longer afford their medication, and they don't.
Yeah.
But that's just a quick scheme. But that goes to answer the question in the chat. This is all about our medicine is like our medical care, our healthcare, our pharmaceuticals, our medicines are all privatized. It's
Hmm.
all about profit. It's not about public good or public interest. If we had a healthcare system that was publicly funded, if
Hmm.
pharma was nationalized, if
Yeah.
the government, the federal government could actually regulate price of drugs with the manufacturers, you could bring costs down. But to me, we have to be open with that. To me, healthcare and public health should be a public good, and we should not care if there's excess or waste. Like there should
Hmm.
be, like we should have. I'm okay of having an extra wing of a hospital that we rarely use unless there's an emergency, or if
Right.
we have extra ventilators that we never use unless there's an emergency, or if we have extra masks that we never use in case there's an emergency. I have
Yeah.
no problem with that.
Right.
But the only reason we do have a problem with that is because everything has to be about for profit.
Yeah.
If we remove the profit motive, and if it's
Hmm.
just about public safety and public health, then these excesses, these extra having the extra space and the extra um, protective equipment doesn't become a problem.
Yeah.
And but it's just somebody has to profit on everything,
Yeah.
and that's why everything costs so much.
Yeah. It's yeah. So I mean, chat. I think that's a pretty solid answer, and
Yeah.
it really is. It's sad, and you even mentioned frontline workers, and even like them not having the necessary things. Well, my wife, she worked
Mm,
at a private hospital at the time when the pandemic, was coming out, and they had to use the same N95 mask
yeah.
for basically as long as they could. They'd actually get reprimanded if they had to replace it early, like because they didn't have it. And it's like one thing if like, okay, you're just serving, but you are dealing with every patient you're dealing with basically has COVID. At one point, told me that their check-in desk, right, as
Hmm.
you do for the emergency room, there was no screening before then, right? So people are
Hmm.
coming up to your face and they're like, "Oh yeah, I think I have COVID," and it's just like zero precautions. But part of it was they didn't have the room.
Yeah.
They apparently didn't have the resources, which was borderline. I'm like criminal for because at this
Yeah.
point we still didn't know
Yeah.
what
It is.
COVID like all is it going to have long if you catch it, are there long term health implications, which I think we still are not entirely sure on, right?
Yep.
Because it
Yep.
hasn't been a long term. Like
Yep.
it's still
Yep.
technically going on. So it's
Yep.
like that to me was just complete ludicrous.
Yeah.
Just but like you said, it's like, well, it's we just didn't have it, and part of it is sometimes like it's not profitable. It's not that's stuff we'd have to replace. So it's
I wonder why
some
nurses
money.
are leaving the profession. I
Y-
wonder. I wonder
Yeah,
why nurses are having serious mental health issues right now. I wonder
yeah,
why, because of the pandemic. I wonder.
yeah, and they're at an all-time low level. Like they've been talking. I'd love to see more studies on it.
Yeah.
Of yeah, they're nurses compassion, right? That
Mm.
big thing that you're really kind of just expecting when you go see like, hey, how can no, that's going out the door. Like
And
you
it's
are,
not a two-way street. It's not
yeah,
like you the way you're
mhm,
saying. I never heard that's really depressing. How they were kind of treated, by the hospital, being reprimanded or something if they don't ask right or something like that.
mhm.
Like there's no, it's not a two-way street. Like just nurses giving compassion, but where is the compassion for the nurses?
Usually, and again, this is just obviously personal experience, but by and large, it's not there, right? You think when you go, but a lot of people don't care because
Yeah.
right, they're upset that they're at the hospital to begin with.
Yeah.
They're let alone if it's like, oh, what do you mean I have to wear a mask? Like that's still a problem. Like in the emergency room, it's like, why am I so being told someone was the other day was upset that why am I so sick? And I'm like, well, you got COVID. And it's
Mm.
like, well, did you do the vaccine? Oh, everyone's always pushing me to do the vaccine. I was like,
Mm.
no, I'm not going to do like, stupid it goes on this whole rant. They're like, basically even the doctor was involved. We don't care, if you do or don't. Reason we ask is you asked us, why are you so sick? This is why you caught COVID, no vaccine. So you're getting the full brunt of it. You didn't want to hear any of it. And
Yeah.
so, and this, those kind of scenarios, it's just, and what it's I've just been being told is like there's zero, like you said, there's zero compassion coming
Yeah.
from um, patients. The administration, oftentimes, at least at this university, this new one that working at is a little better, but
Mhm.
they sometimes it's just like they look at you as nurses as cannon fodder, and I can tell you they had to step up and do a incentive program because travel nurses
Mm,
like were making
mm,
huge bucks.
mhm,
And it's like, man, you know what, fine, if I don't like this place, I'm leaving after
mhm,
whenever my contract's up. And hospitals are starting to see it's like, oh, because it's like if you're not happy somewhere, then of course, yeah, I'm going to take the job and leave. And they're
mm.
seeing huge growth, troves of people leaving.
Yeah.
So they had to change their method, but all of it does ultimately come back to it's like, yeah, nurses just like teachers. Where's all the compassion you're doing for the kids?
Mhm.
It's like, man, because it's like people forgot how to socialize because of this whole pandemic, right?
Yeah.
And we're just it's really unfortunate. Like it
Mhm.
is kind of sad and is depressing to an extent just to see this whole lack of empathy, understanding. People are just like, man, just trying to go through the motions, don't really necessarily see people as people.
And would you do you remember when the pandemic first started? Were you like one of those people? I had this hope that that maybe that we would together, that there would be this division somehow during the pandemic, that we realized that like a lot of the stuff that we'd been bickering about was like stupid, and that we would all come together. Did you have that feeling? I had this naive feeling that the pandemic would bring us together a
Hmm.
little bit. Not, it wouldn't solve
Yeah.
all the problems. Isn't it really interesting? Like I had that feeling. Some other
Mhm.
people, some other naive people I know had that feeling, but
Mhm.
the opposite happened.
Yeah, that we need a national disaster to bring us
Yeah,
all together
I thought that's what
and
it was
be like,
gonna. I thought that's what it was gonna be. But
you would think, it's one of those, if I was in, right, an alien race
yeah,
watching down, I was like, yeah, surely they're going to come together to combat this nope. Opposite, even person in the chat's talking how patients kind of sticking on that,
hmm.
more demanding, less forgiving. And I forgot, I'm glad this got brought up, that they've seen a rise in self-care encouragement from management.
Oh, the nurses.
Hmm.
Yeah, take care of yourself.
Yeah,
Yeah.
and instead of providing support, it's like, well, if you need a day, then we'll give you a day.
Isn't that
But
just, that's just neoliberalism and healthcare? It's like your personal responsibility.
mhm,
We're not going to take any responsibility for your well being. I know as a hospital we're in a horrible position
mhm,
in finding your ability to actually take good care of your patients, and making them wait for hours. And by the time they
mhm.
get to you, they're really pissed. And you should take care of yourself. Good
Yeah,
luck.
yeah,
Good luck.
yeah, exactly. It's part of the job
Yeah.
you signed up for, right? Because you care for the pay. It's like, yeah, it's like that's that's more or less going out the window.
Yeah.
Like they're lucky to have like the amount that they still do because
Hmm.
people are like, or even if you're doing patient care, a lot of nurses, I know quite a few now. Like, yeah, I'm sick of bedside service or actual patient care. So one-on-one, it's like I'll go do the management. Like,
Uh huh.
I want to do management stuff, but like I don't want to see patients
Uh
anymore
huh.
because it's just gotten so bad. And these are from people who like started and right before COVID, super compassionate,
Hmm.
loved it. Come home, even if like
Hmm.
work conditions weren't fantastic, it wasn't nowhere near as horrendous as it. I'm like, it's completely changed the game. Like
Yes, it
it's.
has, and I think that's generalizable. Like any type
Hmm.
of that compassion fatigue,
Hmm.
you can. I think you can see it. Teachers and anybody who's like, I don't. We're just scratching the surface on
Yeah.
all of compassion fatigue and loss. People that have
Hmm.
lost social isolation. So I don't. I mean, we're trying to get back out there and
Yeah.
and go back to brunch, but it's just
There's a
yeah.
huge component, and the last question on
Yeah.
that I will ask is, what about in academia, like
Mhm.
fellow professors?
Yeah.
Like I remember I was there. It was like a ghost hall. Like
Yeah. Yeah.
it almost seems like a scary movie.
Yeah.
A chat context. It's a long hallway with doors, but all these
Uh-huh.
doors are now like closed. But and
Can I
I
tell
know,
you a creepy? Can I tell you just
yeah, yeah.
really quick a creepy story that I heard? So we just hired this woman. and she actually told me she looked up some history about the university
Oh.
before she came to the interview.
Hmm.
You know how those hallways are like circuitous?
Hmm.
It looks like a labyrinth the way the hallways.
Yes.
Apparently, have you heard this story about there? It was
It was
intentional.
intentional. Hmm.
Yeah, to suppress
Student.
protest movements or something like that.
Yeah.
Yeah,
Because UTSA
yeah.
got built during the 60s.
Uh-huh.
Yeah, the all the civil unrest. So if you ever visit the
Yeah.
lovely campus, one,
So
it's
that's
all
true.
concrete. Yeah. Yeah. Oh,
That's crazy.
yeah. And so the
Yeah.
halls, the way the rooms are
Yeah.
numbered is extremely confusing.
Yeah.
And they're like,
And they're all
why?
windy and
It's
yeah.
windy,
Yeah.
and it's honestly a lot of waste of
Yeah.
space. Like, our fourth floor is a fifth of a
Mhm.
floor. Like,
Mhm.
utilize everything else, and you have
That's
classrooms
a
up
good
there.
yeah. Yeah.
But yeah, it's Professor, the relationships,
Yeah.
man, is uh, so interesting. So at the smaller private university I was at, there's still more people,
Yeah.
somewhere in mass, but more like that interaction.
Mhm.
But really, like, I know quite a few professors that are like, I don't think they ever want to come back. Like, just let me do the online. It's like they got exhausted. I know people are starting to look at mental health studies, right?
Yeah.
From sheltering in place.
Yeah.
Like you're saying, perhaps it's that lack of not even their compassion, but it's like no one seems to care. It's like, oh, you lost someone to COVID. It's, you know, it, right. That whole lack of compassion. So I'm curious how that's perhaps been eating at, I know, again, very generalizable,
Yeah.
but specifically
Yeah.
like people in our fields,
Yeah.
because I know quite a few individuals who are like, I'll go there only when I actually teach, and
Yeah.
then it's like going back home. To,
Yeah.
I'm like, it used to be so much more sociable.
Well, it did definitely become a ghost town. I mean, I wasn't even, I moved to UTSA during the pandemic. I wasn't
Mhm.
even allowed to move in the office until like my second year.
That's right.
Yeah, it's like I mean, all my stuff was just in boxes in my office, and they didn't want you on campus
Mhm.
because they were trying to spread. And but yeah, I am hopeful. I'm one of those people that like um I'm not big on just being on campus for being on campus sake, but I do like to be in class, and I don't like online teaching. I'm not a
Mhm.
big fan
Mhm.
of that. I think other colleagues are totally fine with being online. I want to teach in person. I want to
Right.
engage students, so I do want to have that type of in person. Um, all my classes next year are going to be in person, so
Mhm.
hopefully we're getting more slowly reintegrated back into having in person meetings and so forth. Hopefully we'll start to see more of that again. But
Yeah.
I will say this: I feel like there's the in-person classes feel like they're getting lower enrollment.
Mm.
So I have noticed that the online classes because like I think there's a med surg class that was in person and one online, and like the one online had 100 something students, and like the in person had like students, and so this is a concern because the chair like emailed me asking me about it, and it seemed that some of the students are favoring to these online classes.
Mhm.
So it's like it's not just from the faculty side, maybe not wanting to be on campus, but it's
Mhm.
also it seems like
Stu-
some students are preferring, and I actually wonder if that's the older students maybe who had experience on in the campus because like I just think if I was a new student I'd want to have a real college experience be
Yeah.
on campus.
Oh yeah,
Yeah,
I'm right there
yeah,
with you,
yeah,
especially as going through college.
yeah.
I get the why it's nice to teach online, right? It's obviously it's convenient, but as a student, I
Mhm.
hated taking
Yeah,
online classes.
yeah. Yeah,
And
I don't like teaching it. I don't like
yeah,
and I'm too old to ever have even had the opportunity to have an online class when I was a student. But like I definitely would much rather I mean I see the value in online education, but
right.
I personally want to be in class having an English students. I that excites me. I don't online class students will not they won't engage you on.
Yeah,
Yeah.
and someone should just put, one good thing about this pandemic is it just showed us how unprepared we were, and
Oh
so it
yeah.
was like, well,
Yeah.
yeah, without a doubt. And
Yeah.
now look at how we're trying to again back to it. I got told uh, is with regards to the class, oh, you want to teach over the summer? I'm like,
Mhm.
yeah, it's good extra income.
Mhm.
They're like, do online, because if you do a in-person class, it won't make students don't want to do it. And I'm like,
Mhm.
okay. Like, well, initially, I've taught face to face in the summer before. Like, yes, enrollment's lower, but that's because it's summer, right?
Yeah.
People are either going home or
Mhm.
doing other stuff.
It's
But
always lower, yeah.
yeah,
So yeah.
it's always lower. Makes sense. But they're like, if you do in person, the class just will not make.
Yeah.
And I'm
Yeah.
like, that used to not be a thing. Like, it
Yeah.
was an option, but now it's almost, mandatory. Um, so it's just been
It
really.
seems like there's going to be a period of adjustment where students are like easing back into the classroom,
Mhm.
faculty are easing back into the hallways and person meeting, person teaching. Um,